Joining me now on the phone from Des Moines is Senator Tom Harkin, Democrat from Iowa. Senator, welcome to the program. I want to sort of get past the crazy hijacking of these serious conversations and talk about something that I think we haven't put on the front burner. You have been very front and center about talking about the need to talk about personal responsibility, health care, and perhaps changing the conversation back to the middle. Have you been able to do that in your town halls?
Well, yes, Nancy, and thanks. You have a couple hundred people, and you get 2 or 3 shouters and a few others that want to kind of be disruptive. But most people come, and they really sincerely want information. They want to be educated about what's on the bill. They want to ask probing questions, and that's the way it should be. And so I think if we just sort of steer the discussions towards that, and what the positive aspects of the bill are, I find people are very, very receptive.
One of the things I'd like to talk about is 2 very prominent people, Dr. Dean Ornish and Dr. Andrew Weil, have separately published comments about what health care reform should look like. And Andy Weil has said, and I'm quoting him, the wrong diagnosis is being made in this debate over health care. American health care doesn't fulfill its prime directive if it does not help people become or stay healthy. It's not a health care system at all. It's a disease management system, and that we have to make it better, because if we just make, frankly, the system cheaper and more accessible, we're just leading to its dysfunction. I'm going to assume that you agree with that.
Oh, absolutely. I've known both Andy Weil and Dean Ornish for many years, and I've been saying since 1992 that we really don't have a health care system in America. We have a sick care system. And I think when you say that to audiences, they realize, yes, that's right. You know, all of the incentives and everything is on the back end to help you to try to get back to be healthy. There's very few incentives to keep you healthy and well in the first place. And that's what Andy Weil has been talking about for a long time.
So, Senator, as we wait to see what comes out of the Senate, are you going to have the ability to insert that kind of language to maybe fix the system in a bigger way?
Well, I will say that my main role in this health care debate on my health committee is prevention and wellness and public health. That was my title. It's sort of Title III if you want that kind of detail. But we have a big title in our bill that really puts major new emphasis on prevention and wellness. For example, one of the provisions we have says that insurance companies cannot charge co-pays or deductibles for you to go in and get your annual physical, mammograms, colonoscopies, immunizations, or things like diabetic counseling for nutrition before you become diabetic. In other words, if you're pre-diabetic, you can go in and get consultation and work with a health care provider to put you on a regimen so you don't get diabetes.
Senator Harkin, thank you.
A lot of emphasis on moving things up to the front end.
Well, you know, and frankly, turning a bad system upside down, and perhaps we can all take a collective breath and come to between the 40-yard lines and be reasonable people. Senator Tom Harkin, thanks for being with us.